Hello, and welcome to a fascinating journey inside the human body. We often take for granted the incredible things our arms allow us to do, from delicate tasks like painting and writing to powerful actions like throwing and lifting. Our arms are amazingly versatile. But have you ever stopped to think about the intricate framework of bones that makes all this possible? Today we'll embark on an adventure to explore the osteology of the human upper limb, the scientific study of its bones. We'll journey from the shoulder girdle, which anchors the arm to the body, down to the intricate network of bones in the hand. Get ready to be amazed by the complexity and elegance of these natural engineering marvels. Our exploration will take us through four main regions: the shoulder girdle, the arm, the forearm, and the hand. Each region plays a crucial role in the overall function of the upper limb. We'll delve into the individual bones that make up these regions, uncovering their unique characteristics and how they work together to produce such a wide range of movements. Our journey begins with the shoulder girdle, the structure that connects our arms to the rest of the skeleton. This crucial link is formed by two bones, the clavicle and the scapula. Imagine the shoulder girdle as a bridge, and the clavicle and scapula are its supporting pillars. The clavicle, also known as the collarbone, is a slender S-shaped bone. You can easily feel it running horizontally across the upper chest. It acts as a strut, keeping the shoulder joint away from the ribcage. This allows for a greater range of motion, which is essential for reaching and throwing. The clavicle also transmits forces from the arm to the axial skeleton, protecting underlying nerves and blood vessels. The scapula or shoulder blade is a flat triangular bone located on the back of the thorax. It lies over the ribs, forming a flexible base for the shoulder joint. The scapula has several prominent landmarks, including the spine, acromion, and coracoid process. These bony projections serve as attachment points for muscles that move the arm and shoulder. Moving down the arm, we encounter the humerus, the sole bone of the upper arm. This long bone is responsible for the arm's strength and range of motion. It articulates with the scapula at the shoulder joint and with the ulna and radius at the elbow joint. The humerus features a rounded head at its upper end, which fits snugly into the glenoid cavity of the scapula, forming the shoulder joint. Just below the head, you'll find two prominent bony projections called the greater and lesser tubercles. These serve as attachment points for muscles that rotate and move the arm. Moving down the shaft of the humerus, you'll notice a roughened area called the deltoid tuberosity. As its name suggests, this is where the powerful deltoid muscle attaches, allowing us to lift our arms away from our bodies. At the lower end of the humerus, we find the medial and lateral epicondyles, two prominent knobs that you can easily feel on either side of your elbow. These provide attachment points for muscles that move the forearm and hand. The forearm, the region between the elbow and wrist, houses two bones, the ulna and the radius. These bones work in perfect harmony, allowing us to rotate our forearms with remarkable dexterity. This unique ability sets humans apart from many other animals. Imagine trying to turn a doorknob or use a screwdriver without forearm rotation. The ulna, located on the pinky finger side of the forearm, is the longer of the two bones. Its proximal end features a prominent C-shaped notch, the trochlear notch, which articulates with the humerus at the elbow joint. This unique joint structure allows for the hinge-like movement of the elbow. The ulna also plays a crucial role in stabilizing the wrist joint. The radius on the thumb side of the forearm is shorter than the ulna. Its proximal end features a disc-shaped head that articulates with both the humerus and the ulna. This arrangement allows the radius to rotate around the ulna, enabling us to supinate and pronate our forearms. When you turn your palm up, you're supinating. When you turn it down, you're pronating. Section 5. Intricacies of the hand, carpals, metacarpals and phalanges. Finally, we arrive at the hand, a marvel of natural engineering. The human hand, with its opposable thumb, is capable of an astonishing array of movements, from delicate manipulations to powerful grips. This versatility is made possible by the intricate arrangement of 27 bones, divided into 3 groups: carpals, metacarpals and phalanges. The wrist, the junction between the forearm and hand, is made up of 8 small, irregularly shaped bones called carpals. These bones are arranged in 2 rows of 4, forming a flexible and stable base for the hand. The carpals articulate with the radius and ulna proximally and with the metacarpals distally. The palm of the hand is formed by 5 long bones called metacarpals. These bones are numbered 1 to 5, starting with the thumb. Each metacarpal articulates with a finger, providing the structural support for our digits. The fingers, or digits, are composed of small bones called phalanges. Each finger, except for the thumb, has 3 phalanges, proximal, middle and distal. The thumb only has 2, proximal and distal. The intricate arrangement of joints between these bones allows for the wide range of movements that make our hands so adaptable. Section 6, the shoulder joint, mobility with a price. Now that we've met the bony players, let's look at how they work together to create movement. We'll begin with the shoulder joint, the most mobile joint in the human body. This remarkable range of motion comes at a cost, though, as the shoulder joint is also one of the most unstable joints. The shoulder joint, also known as the glenohumeral joint, is a ball and socket joint formed by the articulation of the head of the humerus and the glenoid cavity of the scapula. This type of joint allows for a wide range of motion in all planes, including flexion, extension, abduction, adduction, rotation and circumduction. The shallowness of the glenoid cavity and the lack of bony constraints contribute to the shoulder joint's mobility, but also make it susceptible to dislocation. A fibrocartilaginous rim called the glenoid labrum deepens the socket, enhancing stability. Muscles and ligaments surrounding the joint provide further support, helping to keep the humerus in place. Section 7. Elbow and radioulnar joints. Bending and rotating. Moving down the arm, we encounter the elbow joint, a hinge joint formed by the articulation of the humerus, ulna and radius. The elbow joint primarily allows for flexion and extension of the forearm, although it also plays a role in forearm rotation. The elbow's hinge-like movement is mainly due to the interaction between the trochlea of the humerus and the trochlear notch of the ulna. Several strong ligaments, including the medial collateral ligament and the lateral collateral ligament, provide stability to the elbow joint. In addition to the elbow joint, the forearm also has 2 radioulnar joints, one at the proximal end and one at the distal end. These joints, formed by the articulation of the radius and ulna, allow for the rotational movements of pronation and supination. The interosseous membrane, a sheet of fibrous tissue connecting the radius and ulna, provides additional support and helps to transmit forces between the 2 bones. Section 8. Wrist and hand joints, a symphony of small movements. The wrist joint, a complex joint formed by the articulation of the radius, ulna and carpal bones, allows for flexion, extension, abduction and adduction of the hand. These movements are essential for positioning the hand in space. The many small joints between the carpal bones, known as intercarpal joints, contribute to the wrist's flexibility. The metacarpophalangeal joints, located between the metacarpals and phalanges, allow for flexion, extension, abduction and adduction of the fingers. Finally, the interphalangeal joints, found between the phalanges, enable us to bend and straighten our fingers. This intricate network of joints in the wrist and hand, along with the muscles that control them, gives us the dexterity to perform a wide range of tasks, from writing and typing to playing musical instruments and using tools. Section 9. Clinical applications when things go wrong. Understanding the anatomy of the upper limb bones is crucial for diagnosing and treating a variety of injuries and conditions. Fractures, dislocations, sprains and strains are common injuries affecting the upper limb, often resulting from falls, sports injuries or overuse. Fractures of the clavicle, humerus, radius and scaphoid, a carpal bone, are particularly common. Dislocations often affect the shoulder and elbow joints. Carpal tunnel syndrome, a condition that causes pain, numbness and tingling in the hand and fingers, occurs when the median nerve, which runs through a narrow passageway in the wrist called the carpal tunnel, becomes compressed. Arthritis, a condition that causes inflammation and pain in the joints, can also affect the upper limb, particularly the shoulder, elbow and hand joints. Osteoporosis, a condition that weakens the bones, can increase the risk of fractures in the upper limb, especially in older adults. Section 10. Conclusion. A marvel of engineering and evolution. As we conclude our exploration of the upper limb's osteology, we can't help but be awestruck by the intricate design and remarkable functionality of these bones. From the sturdy clavicle and scapula that anchor the arm to the body, to the precisely engineered joints that allow for an incredible range of motion, the human upper limb is a testament to the power of evolution. Understanding the anatomy of these bones and how they work together is essential for appreciating the incredible feats our arms allow us to perform every day. Whether we're painting a masterpiece, playing a musical instrument, or simply reaching for a cup of coffee, we owe a debt of gratitude to the remarkable framework of bones that makes it all possible. So, the next time you use your arms, take a moment to marvel at the intricate dance of bones, muscles and tendons that allows you to interact with the world around you.